Good afternoon, ladies and gentlemen. Good morning. We are set to go. This afternoon, we are going to have a conversation from a cross-regional panel to discuss financing for tobacco control in Africa, examining where we need to take it and where we are at the moment. But to contextualize the discussion, colleagues, we need to first have a few points in mind. One being that the World Health Organization Framework Convention provides a checklist for evidence-based policies to decrease tobacco consumption and prevalence. However, it leaves a gap between the existing domestic and international financing vis-a-vis against the current need, which approximates to about 27 billion, to have a full-scale implementation of the Framework Convention to be able to meet or to address the demand reduction measures globally. But the gap is more visible in low and middle income countries. And this gap is not new, it has been long-standing for quite some time. We also observe inequalities in supporting a comprehensive tobacco control in most countries. And again, further examination demonstrates that most countries do not have a line budget in their national budgets for tobacco control, making tobacco control falling short of being a priority and not be able to be captured in the national accountability framework across the board. And this one creates a need for domestic resource mobilization, but we know that the resource mobilization does not conduct itself. Even in areas where countries have acted to impose taxes, even taxes cannot correct themselves. So we need to have a conversation around how we can raise additional resources and sustain them to foster tobacco control. So this afternoon, our dialogue is going to be guided by three objectives. One, to highlight the critical, central, and urgent need to increase funding for tobacco control, particularly in low and middle income countries where we reside and which fits within this conference, but also to review the current state of funding programs at both regional and international levels, as well as the national levels, but also to be able to propose actions to increase and sustain funding for full implementation of the Framework Convention. So to do this, we shall have Mr. Leslie Bray from the Framework Convention Alliance to moderate a session of distinguished panelists who are going to examine financing from different aspects and to be able, at the end of the day, to converge in terms of gaining consensus on how we need to take financing for tobacco control on the African continent forward, so as to be able to sustain financing for tobacco control, making it more prominent, gaining space in the national discussion table, as well as being part of the national accountability framework, so as to realize equity in terms of implementation of the Framework Convention measures and articles across board. So at this point, I would like to take this opportunity to invite Leslie to pick it from there and get the ball rolling. Leslie.
Thank you so much, Dr. Jim, and apologize in advance to everyone for the background noise. It's just a little early over here and so it's a bit noisy, so apologies. Really excited to do this cross-regional panel discussion during this conference today. We have about 40 minutes or so for the panel, and then we will open up for questions from the audience. So I don't want to spend too much time. We'll introduce speakers, I think, as we invite them to come in. But I'd first like to turn it to my colleague, Sarah Rose Taylor, who is the principal researcher and policy analyst from the Framework Convention Alliance, who's just going to give us a very brief overview, looking at kind of what are these global trends before we move to the regional part of the panel. So I'll turn it to you, Sarah. Please go ahead.
Thank you, Leslie. As you mentioned, I'd like to provide an overview just of those current trends to provide some context for the panel discussion. So one of the major barriers to progress on FCTC implementation, as we know, is a lack of adequate sustainable resources. And it's particularly the case in low and middle income countries. We see a lack of adequate financial investment, both from many governments and also from international donors for a variety of reasons. As of 2018, total average investment in tobacco control in low and middle income countries was at only 2 US cents per person per year. That's really not going to get anyone very far. And half of that comes from national governments, with the other half coming from international donors on average. In terms of national government funding, we need to think about domestic resource mobilization, often in terms of tobacco taxes. So tobacco taxes not only save lives by reducing tobacco consumption, but they also create an important source of revenue. Right now, it's often a missed opportunity, as most countries could stand to increase tax levels on tobacco products. Only 1 in 5 countries globally have tax rates at the best practice level, which is between 70 and 75% of retail price. Further to that, of the $250 billion US of tobacco tax revenue collected globally every year, only about 1 billion is spent on tobacco control, and the vast majority of that is in high-income countries. So really, there are significant opportunities for funding tobacco control if countries increase tax rates on tobacco products and devote more of that revenue to tobacco control. The other side of the coin, as I mentioned earlier, is funding from international donors. So in 2019, tobacco control programs received roughly $66 million US in development assistance for health. That represents only 0.16% of all development assistance for health provided globally. So it's really a tiny fraction. And that's just for development assistance for health specifically, not considering all development assistance across all issue areas. So in effect, it's not just a drop in the bucket, it's kind of a drop in the ocean. It's also only a small fraction of what would cover the global funding gap for tobacco control. The estimated cost to globally scale up demand-reducing FCTC measures stands at $27.4 billion US. So when you compare that with the current level of development assistance for health, that 66 million I mentioned, that would only cover about 4% of the funding gap. But when we think about, for example, globally, the 250 billion collected in tobacco taxes annually, that could do a lot, but with only 1 billion going towards tobacco control now, there's a lot of room to improve. And I think that's kind of the main takeaway here is there still exists a large global funding gap for FCTC implementation nationally, regionally, and globally. And current efforts are unfortunately inadequate to address that gap. And of course, the ongoing pandemic is only making this more difficult. And that's why today's discussion is so important, so we can discuss solutions that can facilitate progress. Thank you.
Thanks so much, Sarah. So really good numbers in there, and we probably didn't get them all off by heart, but I did capture kind of the $27.4 billion and only having about 4% covered from international funding, and then a small fraction, the 1 billion covered from taxation. So I think there's still a lot that we can do to try and fill that $27.4 billion funding gap. And hopefully some of our panelists today have the solution to that. I'm not putting any pressure on them, but I think that they do have some really good solutions. So before we hear from the different kind of regions on some of the things that they're doing to address this gap, I just wanted to turn to Bettina Adwiza, who's the program officer for tobacco control at the African Capacity Building Foundation. Just for a couple questions to you, Bettina, if you wouldn't mind turning on your camera. Great, thanks, Bettina. Hi.
How are you?
I'm very great. Great, thank you. So I wanted to just ask you first, when we get started here, kind of for a quick overview of the current kind of snapshot from the African perspective, as we are listening in the African Conference for Tobacco and Development, and some of the regional trends in terms of funding in the African region.
Oh, thank you very much, Leslie. We have observed that the tobacco control in Africa relies mainly on external funding, with the major contribution coming from funders like the Bill and Melinda Gates Foundation. We also have main partners such as, I think, yourself, the FCTC Secretariat, the WHO Afro, and the FCA also, being able to mobilize some funding from various donors, mainly from northern countries like the United Kingdom, and also from other development partners and reputable institutions like the Norwegian Cancer Society and Cancer Research UK. We have also realized, I think Sarah talked about the resource mobilization. Domestic resource mobilization has also increased in Africa, with more countries establishing the tobacco control funds. I think this was a send-off discussion yesterday with one of the panel sessions. And mechanisms have been put in place for earmarking, for levies to support tobacco control and public health programs. But these are just a few countries. Notable examples, mainly from Botswana, Kenya, Gambia, Gabon, Mauritania. However, they are facing some challenges, some of these countries, in terms of putting up the mechanisms or making the tobacco control fund functional. Hence, we see that the domestic resource mobilization is still on the low side. We have also seen that research is being supported through the academia with partners such as the Cancer Research UK, the National Institute of Health, the IDRC, among others. However, we've also realized that partnership and coordination is another way to leverage resources in Africa for sustainable tobacco control. And we need to nurture and encourage more partnerships if we are to sustainably support tobacco control in Africa. These are the few examples that, or the few trends that we have seen in Africa. Thank you very much, Leslie.
Thanks, and that's really encouraging to know that, you know, some of this is starting to pick up. But I think, as you mentioned, Bettina, that's just, you know, a couple of countries that have really started to try and harness domestic resource mobilization. And there's still this kind of trend of having some, just, you know, I think bigger donors that are funding, especially the philanthropies in the African region, and which is great. But I think, as you said, more partnerships and collaboration will be really important if we want to increase that. So I just have one other follow-up question for you, Bettina, in terms of you know, why we think funding remains so low, in the sense of, you know, it was a really big deal to get tobacco control included in the SDGs in 2015, but we're still not really seeing this big commitment from donors to put more money into tobacco control, now that it's kind of been seen as a very important development priority. So why do you think that we haven't seen any more commitments from donors, and why funding still remains so low from the external funding side that you mentioned?
Thank you very much, Leslie. I think there are three key issues that explain the rationale behind that, why this is happening in the Afro region. The first being competing priorities within the nations, and then the second one being tobacco control not being considered a priority, and the third one, tobacco control not yet integrated in development agenda. So we can see that the civil society, who are our advocacy, and the tobacco control partners, they need to be at the table where funding for SDGs and NCDs are discussed. Many CSOs are not aware of those platforms and are not effectively engaged for those meetings, or having the skills also to engage effectively to get funding and attention or a priority. We are also seeing that there's need for more voices. We are failing to make up our voices being heard beyond the tobacco control community. I think this was also said yesterday. So this makes it difficult to receive enough resources from the donors. Then also the CSOs and tobacco control actors, they need to be where these decisions are made and articulate the issues on tobacco control or public health to the donors, so that priority is being given to tobacco control. So I think these are the three issues that we realize, maybe if they are being articulated well, we may see a change or a transformation to tobacco control. Thank you.
Thanks, Bettina. And I'm really glad you mentioned those points without us actually speaking about them ahead of time, because I think one of the things that we've noticed the most, and we're trying to work with some with some countries to do this is, like you mentioned, how it's not considered a priority at the national level, and therefore it's not included in the development plan, and therefore there's no funding coming from development partners because it's not considered a priority or included in their plans. So I think that beyond just focusing on the domestic resource mobilization via taxation, it's really important for countries as well to really lobby and advocate at the government level for tobacco control to be considered a major priority in NCDs more broadly, and then to include those in the development plan. So maybe we'll come back to that a little bit later, but some really good points that I think it's beyond just looking at taxation and the money perspective, but also looking at how to kind of prioritize tobacco control in a much broader agenda. So thanks so much, Bettina. Don't go anywhere because I'm sure we'll have some follow-up questions for you there.
Thank you.
But I wanted to turn it now to, we've got 3 speakers. I'm really excited to introduce the next 3 speakers coming from 3 different regions to look at some of these kind of potential financing solutions. So I'd ask maybe if the next 3 speakers wanted to turn their cameras on so I can introduce you to everybody. Great. So we have Fernando Jacome, who's from the Ministry of Health in Ecuador and is also president of the MOP, so the Meeting of the Parties. And then we also have Teresa Habitan, who is the Assistant Secretary from the Department of Finance from the Republic of the Philippines. And then we also have Wele, who is the Executive Secretary of the Ligue Sénégalaise contre le tabac, LISTAB, who I think is having some connection issues, so we might not be able to see his face. But I wanted to just ask the 3 of you, starting with Ms. Teresa Habitan from the Philippines, if you could kind of, in a couple minutes, just talk about, from your perspective and your country's perspective, what is a solution that you use to try and fill that kind of national level funding gap for tobacco control programs?
Hi, based on the Philippine experience, taxation remains to be the best financing solution for tobacco control. In the past decade, the Philippines has raised tobacco taxes 3 times. So in 2012, in 2013, in 2012, in 2017, and again in 2019. So we were also among the first countries in Asia to tax e-cigarettes and to provide tax distinction between salt, nicotine, and freebase vapor products. So the 3 tobacco tax reforms have significantly increased the share of tobacco excise tax collection to GDP from 0.3% prior to the reform in 2012 to 0.6% in 2013, effectively doubling it, the share, then to 0.8% in 2020. And for the next year, for 2022, it's close to 0.9%, and it will reach 1% by 2024. So these reforms have more than tripled the share of tobacco excise tax collections to GDP from 0.3% to 1%. In terms of the money that it has raised for the Treasury, in 2012, we were able to raise only 0.8%, $0.8 billion. That's prior to the reform. And in 2020, despite the pandemic, this has already increased to $3 billion. So that's a lot of money for the Treasury. And the volume of removals decreased from 5.8 billion packs in 2012 to only 3.3 billion packs in 2020. So we were able to achieve our health objective. This is an overall decline of about 42.5% compared to 2012. And with additional excise revenues from tobacco products, we were able to provide sustainable financing source for the universal healthcare program of the country, other health expenditures, and enroll the poorest families under our national medical insurance. So from 2014 to 2021, about $6.2 billion US dollars of excise tax revenues has been earmarked for the universal healthcare program and other health expenditures of government. This is equivalent to 39.2% of the total tobacco excise tax collections from 2013 to 2019. For 2022, the earmarked funds will be higher for health because this has been increased to 50% of total tobacco excise tax collections, or about $1.5 billion US dollars, of which 80% or about will be for PhilHealth. From 2022 to 2026, the estimated total earmarked funds for health will amount to about $10.4 billion US dollars, or with 80% of it going to health. to PhilHealth and 20% to funding medical assistance and health facilities in enhancement programs. Now, we were able to do this because we were able to convince Congress that this was important. And the benefit of this was because it's a law, the reform is institutionalized. However, in other situations, having a legislation can also be very challenging because adverse interest groups with limitless resources can mount a strong lobby in Congress against higher taxes on tobacco.
Great, thank you so much. Really great numbers there. I was trying to jot everything down, but that's really phenomenal what the Philippines was able to do. So congratulations to you on that. And I'm going to come back to you on another question, but I first wanted to turn it to Fernando and hear for the case of Ecuador and how you've managed to fund your tobacco control program. Go ahead.
Well, thank you very much, Leslie. I think that both Bettina and Teresa have already mentioned some key aspects, and it is key to understand that this is not only a matter of taxation. There is some other implicit and key concepts that must be involved. It is we can have a good collection of money through taxes. However, and as Bettina and Teresa already said, if you don't count with enough political support, but overall with the political guidance and view in terms of where to locate these resources for the development of public policy and health system and the strengthening of the health system, where basically there could be the chance where that money collected from the taxations based on the policies of the tobacco control work will not be able to be used for the purpose. So in this regard, I think that it is key both, and I think that the Philippines have a pretty similar experience to what we have done in Ecuador, which based on the framework and the protocol, we have been able to reestablish and to reform the law into 4 occasions from 2006 to 2016, by which we have been permanently increasing the taxes on the cigarette use. Right now, you in our country, you have to pay around 0.16 cents per US dollar per tobacco per unit. However, at the moment, every other tobacco related product is paying around 150% on taxes. So we are having a good collection system, but we are also working pretty hard in terms of the traceability, and that's key for us, and the interinstitutional work in terms of we have a taxing system which is working, but we are working harder into the traceability systems and the intersectional cooperation and interinstitutional cooperation to make sure that we are able to trace and we are able to tax what we are supposed to tax. And of course, as Teresa said, there is a big competition and there's a big problem with the industry and other interest groups. However, that's the key to support from a social basis and from the health system and the intersectoral work, this problematic. So I think that taxation is the key, has been the key in the case of Ecuador as well in terms of collecting money, but that's only the mechanism. However, there is a key factor, which is the governance, which is the following up process, and which is the traceability processes. So without those, it doesn't matter how much money we can collect. If we don't have the law, if we don't have the traceability, there is no way that money will end and will serve for the purpose. That will be our contribution for the moment.
Great, thanks so much, Fernando. And you mentioned the political support and is key as well. As you said, I think we've seen a lot of countries who were able to collect the taxes, but then what actually happens with that funding that's collected is a really big kind of political piece of the puzzle, right? Because I think we've seen it that it's been collected and it's going to other areas and it's not supporting kind of key health programs and priorities. So that political piece is really important, and kind of following that chain of where that funding goes, and the advocacy and everything doesn't stop just when you've collected the taxes. So that's a really good point there. I wanted to turn it to Welle now, who has a very different perspective to share, coming from civil society in some of the work that they've done to kind of try and find a solution at the national level in terms of getting increased investment into tobacco control. So Welle, can you hear us okay?
Oui, merci. Bonjour tout le monde. Merci donc aux
Walid, excusez-moi, juste une seconde.
différents
Walid,
orateurs.
Juste une seconde, Walid, je vais juste dire à tout le monde de mettre l'interprétation si
Oui.
ils veulent. So Walid's going to speak in French. So if anybody wants to have the interpretation, there's the interpretation button at the bottom of the screen for you to have the interpretation in English. Donc allez-y, Walid, ils vont mettre l'interprétation. Allez-y.
Voilà, merci beaucoup. Donc, je disais, je rejoins les collègues donc, qui m'ont précédé pour remercier et saluer tout le monde. Donc, pour l'organisation donc, de ce panel qui est si important, surtout donc, en Afrique où les défis donc, sont énormes. Par rapport donc, à la question donc, de Leslie, donc, je pense que il faut que nous puissions comprendre en fait que quand même malgré tout ce qui a été fait, il y a quand même beaucoup de défis donc qui nous attendent. Mais malheureusement, ces défis sont confrontés donc à quelques obstacles. Voilà, donc c'est des obstacles juridiques tantôt, mais également un manque d'engagement et de volonté politique, mais surtout une absence de formation dans ce domaine, parce qu'il faut que quand même tous les acteurs soient outillés du côté donc des gouvernements comme du côté également de la société civile pour pouvoir vraiment mener ce plaidoyer donc au plus haut niveau. Donc ça c'est vraiment donc des obstacles que nous avons notés au niveau quand même de certains pays et également comme le savons tous. Au niveau international, il y a quand même déjà des mécanismes, il y a déjà des directives. Je donne déjà l'article 6 de la Convention, que vous savez tous, mais aussi l'article 26 de la Convention qui impose vraiment aux parties d'appuyer, en tout cas, d'apporter un appui financier donc, pour la mise en œuvre donc, de la CCLAT à travers donc, des lois. Ça veut dire qu'en fait, nos États n'ont pas les moyens de leur politique, donc, alors que des mécanismes existent. Les mécanismes sont là avec de différentes expériences dans beaucoup de pays que nous pourrions vraiment partager avec l'appui donc de la FCA qui a eu donc à mener donc un projet pilote au Sénégal et en Ouganda. Donc, je pense que les résultats de ces différents projets doivent être partagés au plus haut niveau partout pour que vraiment tous les pays concernés, tous les pays déjà qui veulent aller vraiment dans ce sens-là puissent vraiment donc s'appuyer donc de ces différentes études et de ces expériences. Maintenant, il y a également un autre obstacle, c'est toujours du côté juridique, parce qu'il faut le dire, il y a toujours un problème donc de répartition des ressources. Parce qu'on a l'habitude de dire que ça ne sert à rien de mobiliser des ressources, de mener le combat, de mobiliser des ressources et que la lutte contre le tabac donc, soit mise à côté. Bon. Je donne l'exemple du Tchad et également l'exemple du Gabon. Pour le Tchad, le travail a été mené et il y a eu vraiment un pourcentage qui a été affecté. Mais malheureusement, le plus gros parti donc la plus grande masse donc de ce financement va donc dans d'autres secteurs différents donc du tabac. Donc il est très difficile donc pour la lutte contre le tabac de pouvoir en tout cas avoir au moins un pourcentage important. Ouais, donc ça c'est toujours donc des problèmes que rencontrent ces pays, surtout dans les clés de répartition. Je pense qu'il va falloir vraiment accentuer donc la réflexion là-dessus pour outiller davantage, pour pouvoir vraiment renforcer donc certains acteurs à pouvoir mener donc le combat, parce que ce que nous sommes en train de faire, c'est vrai, c'est valable pour les maladies non transmissibles, mais c'est aussi valable donc pour la lutte contre le tabac donc de manière générale, parce qu'aujourd'hui nous sommes tous appelés à demander des financements au niveau donc des partenaires extérieurs, alors que il y a quand même le financement domestique qui est là, qui est exploité. Il y a également des mécanismes donc, par rapport à la taxation du tabac pour essayer de régler, de résoudre un certain nombre de problèmes par rapport donc aux programmes donc, qui sont là, qui sont faibles donc, de par leur budget. Donc ça, je pense que c'est un travail qui doit être mené, que ce soit par la société civile, mais aussi par en tout cas les gouvernements.
Super, merci beaucoup, Wale. Je vais me remettre en anglais pour les autres, mais merci pour votre intervention. And so, you know, we heard a lot of the challenges, and I think we want to come back to you after, Wale, and hear a little bit more about the project that you mentioned, the pilot project going on in Senegal and Uganda. So we'll come back to that in a second. I just wanted to turn back now a little bit to the Philippines and Ecuador. As you spoke more about kind of taxation and some of those key kind of pieces to that puzzle. But what are, in your view, the terms of the really like the critical next steps that countries have to take who aren't quite there yet? Because I know it's quite a process, right? And as we talked about, it's not just increasing taxes. There's a really big process there. So what are, in your view, some of those next steps that countries need to take to try and get to that next level? I'll turn it to you first, Teresa. Please go ahead.
Okay, thanks, Leslie. As Fernando has said, it's not just a matter of increasing tax rates on tobacco products. You also have to be very strategic in the ways that these tax revenues are distributed and where the benefits are going. And what helped our tobacco tax reform is when we gave in to earmark them to PhilHealth so that people were able to realize and feel themselves the benefits that come from taxation. Tobacco taxation has proven also to be very reliable for government, even during the pandemic. And I think that's very critical, especially now. So even as the volume of locally manufactured cigarettes declined by 43.4% last year compared to 2019, excise tax collections actually increased by 0.9% from 146 billion pesos, I'm talking pesos now, to 149 billion pesos in 2020. So it proves that tobacco products are inelastic when it comes to taxation. And for this year, in the first 8 months, our tax collections from tobacco increased by 55% compared to the same period in 2020. And the volume of removals also increased by 39.4%. So we think that demand, the volume is beginning to normalize. Now, what countries increasingly must watch out for, and that includes the Philippines, and be prepared for, is the shift of the industry of tobacco companies away from tobacco products to smoke-free nicotine products. One of the giants of the industry is moving towards investment in health and wellness products, pharmaceutical companies, including non-nicotine pharmaceutical products. So as the industry starts to move away from tobacco-related revenues, or as I say, beyond nicotine, tax structures of governments must adopt. Initially, for example, by taxing vape products and e-cigarettes at the same rates as cigarettes, as the Philippines has already done. But countries must have a longer-term view of how to tackle these developments in the industry, so as to protect this a very strong source of revenues for tobacco control.
Great, thanks. Thank you so much. So now I'll ask also Fernando the same question about kind of what do you think some of those critical next steps are as well for countries?
Yes, well, over this point, I will try to also to bring some of the main ideas that we have been discussing into the last intersessional sessions of the meeting of the parties, which basically are really concerned about these aspects on what are the key messages and issues to move forward in order to warranty not only the access to finances, but also to sustainable policies in terms of the fight against tobacco as a pandemic and the illicit trade on tobacco. So in this regard, there are key elements that must be strengthened, as we already mentioned, and I think that Dejaville made a pretty brilliant introduction in this regard. This is not only a matter of social responsibility and NGOs and philanthropy. This is a matter of raising awareness among public policy makers, and this is a matter about a common and a joint work among public institutions. Tobacco is a pandemic. Through the COVID-19, we have seen some deterioration in the pandemic based on some difficulties on the trade, etc. But it kills a lot of millions of persons around the world every year, and this is not well positioned in terms of policy speech. And in this regard, there are a lot of efforts that must be conducted from several institutions. This is not only a matter of public finances. This is not only a matter of public health. This is a matter of intersectorial work. And in that regard, we have to make sure that we can provide and we can advise the policymakers to make sure that they understand that there is security involved, that there is trade involved, that there is national safety involved, and this is a public health issue. So in that regard, that intersectoral coordination in hand with a good traceability process and mechanism in accordance with a strength and policy framework can help us to move forward. So in that regard, there is an important work to be developed among civil society, among pressure groups with the industry to make sure that we understand each other. And this is not a matter of looking at it at an enemy also. Like, we have to make sure, and we have to be sure that we can work proactively with all the sectors of society to make sure that we can have an active and overall structured cooperation among the parties to fight against this pandemic. This is not a matter only of raising money and spending money or making traceability. This is an intersectoral work, and that is a key factor that, as I said before, have been a key issue for the discussions among all the parties, and we have to go into that line to create functional cooperation mechanisms. Thank you.
Thanks, and that's a really important point. I think we're starting just to talk about that a little bit more, about that kind of, breaking the silos within government to be able to kind of tackle some of these really big challenges, and that, governments just working in their own silo is not really going to help address these really big problems. And I think when it comes to tobacco, you mentioned it's not just health and finance, right? So now we're seeing a little bit more, some discussions happening between health and finance, but it's still beyond that, right? And now, especially with certain areas for those, parties or countries who are parties to the protocol, for example, they have the law enforcement and customs, and then trade is a really big piece. And I think that also has to happen within, outside of government, looking at civil society organizations and other international organizations, is we're still in a very siloed, kind of narrow-minded way of working, in the sense of, it goes just beyond health and tobacco control. And so I think it goes back to was it your first point, or actually Bettina's point on collaboration and partnerships? I think intergovernmental and also outside of the government as well. And I think we'll come back to that in a second. I just wanted to turn back now to Welle for a second, and ask a little bit from the civil society perspective, and I'll repeat the question for you, Welle, in French, about the work that you were doing, because I think that the awareness raising came up quite a bit as well. And so I wanted to just turn back to that, about kind of the way that civil society in Senegal has been working about kind of raising awareness within the community and the public, but also into the government about the importance of tobacco control. Donc, Welle, est-ce que tu veux me parler bien pendant 2 minutes, peut-être comment vous avez fait pour faire du plaidoyer aussi, l'éducation auprès du gouvernement et le public par rapport à l'importance de l'investissement dans le contrôle de tabac?
Oui, merci Leslie. Donc, par rapport à votre question, je pense que, pour parler de l'expérience de la société civile sénégalaise par rapport donc au plaidoyer budgétaire, les activités ont démarré quand même depuis 2020, et ça c'est avec donc le soutien donc de la FCA. Donc, la société civile a été outillée, a été renforcée, a été formée. Et c'est dans ce sens-là donc que nous avons élaboré ce qu'on appelle un document de plaidoyer avec vraiment des arguments solides, en faisant donc un peu la différence aux différents budgets donc, qui sont alloués au ministère de la Santé et répartis donc dans plusieurs programmes. Donc nous avons vu qu'en fait le programme tabac était le dernier programme créé, mais le dernier programme, ou en tout cas le programme qui reçoit un budget vraiment relativement faible qu'on appelle budget de fonctionnement. Nous avons également eu à faire ce qu'on appelle des simulations en s'appuyant également sur l'expérience ou sur les outils donc, du CRES, mais également de ACS. Ces simulations nous ont en tout cas permis de pouvoir faire des propositions et la société civile sénégalaise a fait une proposition visant donc à augmenter les taxes sur le tabac, c'est-à-dire une augmentation de 225 francs sur chaque paquet de cigarettes. Cela reviendrait donc à avoir une enveloppe budgétaire de plus de 18 milliards de francs CFA. Et cette enveloppe budgétaire donc, permettra donc de pouvoir renforcer certains programmes. Maintenant, par rapport à la sensibilisation concrètement, nous avons identifié les cibles vraiment principales qui sont concernées par rapport à la question, mais aussi qui sont censées prendre la bonne décision. Je prends l'exemple donc du président de la République, qui est la première autorité donc à être sensibilisé, donc à recevoir donc l'argumentaire, à recevoir également les différentes propositions, mais également le ministère des Finances. Le ministre des Finances qui est censé également prendre même des initiatives allant dans ce sens-là, parce que cela a été fait donc dans beaucoup de domaines. Et également les parlementaires que nous avons reçus hier, donc parce que bientôt nous allons aller en session donc, budgétaire au Sénégal. Donc, ça va ouvrir au mois de novembre et les négociations donc, vont commencer. Et hier, nous avons pu rencontrer des députés pour en tout cas les sensibiliser sur la question donc, de taxation, mais aussi sur la création d'un fonds national donc, de lutte contre le tabac alimenté, qui sera alimenté par la taxe donc, sur le tabac. Et également, les résultats sont en train vraiment d'être, en tout cas, on est en train de voir les résultats, parce que juste après les premières séances de sensibilisation, le ministère des Finances a été vraiment réactif. Et aujourd'hui, nous sommes en train d'aller vers 100% de taxes. Le Sénégal va quitter 65% à 100% d'ici donc quelques semaines. Ce n'est pas encore officiel. C'est juste donc pour vous dire qu'en fait, le travail de la société civile est en train de payer. Maintenant, le reste sera complété au niveau de l'Assemblée nationale avec les députés pour qu'à partir de 2022, qu'on puisse vraiment allouer une partie des recettes fiscales à certains programmes, comme le programme des maladies non transmissibles, particulièrement aussi le programme donc, de lutte contre le tabagisme. Donc ça, je pense que c'est déjà un pas que nous allons franchir en attendant donc de pouvoir développer jusqu'à avoir en tout cas carrément un fonds avec un budget donc dans la durabilité.
Super, merci beaucoup, Vélé. And I think that's a really important piece of work that you just mentioned, was looking at from a civil society perspective. What is that kind of argument when you're going to your government and trying to raise awareness within your government? You know, and I think that when we were looking at this project a while ago, we thought about the argument doesn't have to be taxation, but it just depends on where the government is at, but looking also the return of investment. So we were working with, you know, the University of Illinois Chicago at the time, which was the American Cancer Society, and they were running a lot of numbers to look at, you know, if you invested X amount of funding into a tobacco control program, how much money your government would actually save. And the return of investment is huge. And so making those arguments in those cases for tobacco control programs, whether it be the return of investment argument, the taxation argument, but it's just really trying to get out there and raise awareness about the importance of investing in healthcare and tobacco control and NCDs more broadly. I had one more question for the panelists, but I'm just conscious of time. So I was just going to see if anyone had any questions that they wanted to ask. If not, I could ask 1,000 more. I'm so interested in this topic, but I'll maybe just see if anyone else from the audience wanted to ask any specific questions to the panelists. If not, then I'll continue. I know, Fernando, you might have to leave soon, and that's totally fine. But I'll just maybe stop there and see if there's any questions. If not, as I said, I will ask one more to the panelists. Okay, I don't see any questions coming up right now in the chat or any hands up, so that's okay. We can keep going. I just wanted to ask one more question. Apologies, it's getting a little loud in here now. I think we'd already talked a lot about the kind of institutional bottlenecks, so I don't know if I want to go back on that, but maybe look at kind of what we can learn from the other regions and what we can kind of take away in terms of kind of you know, looking at some of those bottlenecks that we talked about, so the political will, the lack of kind of awareness and education, you know, being able to kind of ensure that this is the priority, like Bettina talked about. So Bettina, feel free to come back in here if you want. Also, Sarah, feel free to come back in about what we can kind of learn from each other to address these different bottlenecks that we've heard. So maybe Bettina, if you want, I maybe might start with you. I know I didn't ask you this question ahead of time, so apologies. But if you have any other kind of suggestions that you could kind of give to look at a way to address this bottleneck of tobacco control not be considered in a priority or in development plans, if you had any kind of thoughts about how we could kind of start to tackle that big part of the problem.
Yes, thank you very much, Leslie. Yes, indeed, it is a bottleneck, but we, from the African region, we have also realized that there is need for a comprehensive national tobacco control program or a strategic plan that should guide the allocation of these financial resources. So it is also critical, in order to address this, it is important to have a fully costed national tobacco control program or strategic plan that guides the allocation of these resources. And this should be coupled with the strong advocacy skills, especially from the CSOs, so that they can be allocated these resources. They speak with one voice, and then they can be allocated these resources. In addition, you also talked about the local evidence. It should be supported by the evidence, local evidence, to show the impact. Once resources are given to these CSOs, what impact will it bring? So it is important to always have local evidence to support the arguments for the allocation of these resources from the national governments. Thank you.
Great, thanks so much. And I'm just putting I guess a promotional flyer in there for the colleagues at the University of Illinois in Chicago and the tobacco economics team who are working on that, kind of to get that national evidence that's needed to be able really to back up your argument, because you know, people need to understand why it's so important to invest in tobacco control. You can tell them all they want, but they need to see that local evidence. So I think that's really important, and the work that the colleagues are doing at UIC is really phenomenal. So just something to kind of keep in the back of our minds. I see Fernando, you have your hand up. Please go ahead.
Yes, thank you very much, Leslie. I will have to leave right now, but I wanted to first, and to leave the panel, I just wanted to answer to your question. I appreciate Bettina's word. Those are key to me, and basically goes with the message that I want to bring right now. There's a lot that we can learn from different regions, problematics, and even the way we manage with the industry is different, and we really have to foster this kind of dialogues, which are pretty helpful for all of us. But overall, based on what you said before, thinking about the cost benefits of the inclusion of policies against tobacco industry and tobacco pandemic, it will make total sense of what Bettina said, to create funded programs in every country to fight against tobacco illicit trade and to control tobacco pandemic. But this is difficult, and as we said before, it is a political issue as well. But in this regard, it is key to work into the establishment of at least mechanisms of national coordination for control of tobacco, and that is key, and that is a key aspect, to strengthen those kind of mechanisms that sometimes are pretty weak in terms of different institutions or located in a Ministry of Health and do not have enough support. That will be key. But we also have to work pretty hard in terms of the strengthening of the systems of traceability. That is key. Without traceability, we don't have a chance to fight against tobacco. And finally, I would like to make sure that there is a total need for us to create guidelines in terms of the fulfillment of transparency in the relationship with the tobacco industry. And that is key in terms of how we construct the mechanisms, the follow-up mechanisms, and the national processes to fight against this pandemic. So with that, I would like to thank you all for these valuable dialogues. It is my pleasure to have been participating in some of them. And please take in mind that we are coming with the COPs and MOPs into the next month, and those are key, and the regions must be prepared for the dialogues and from the next year's commitments. So I will see you in there as well. So thank you very much,
Great,
Leslie.
thank you so much, Fernando. And yes, we will see you online for 2 weeks, in 2 weeks. So thank you so much for joining us. I know you have to run as we started late, so take care and thanks again for your valuable contributions. Thank you so much. So I'll turn then, I guess, to Teresa and also look at kind of these lessons or things that we can pick up from the other regions or any kind of messages that we can bring back about what we can learn from each other to address some of these bottlenecks and challenges that we've identified.
Thanks, Leslie. I think one important thing that we need to remember is getting the reform is one thing, and you feel the euphoria of success. But you know that the next day you need to start working again, because as soon as you have that in place, you have implemented the increase in taxes, for example, there will be nefarious activities outside, which would be going into counterfeiting the cigarettes, counterfeiting the stamp taxes for cigarette products. There will be smuggling that will be there. And the administrative machinery of government must always be at full capacity, optimal capacity in order to catch that. And there's also the need for data, because as Bettina said, this must be evidence-based. When you need to advocate for more reforms, for more policy reforms, people will believe data, people will believe evidence. So there has to be a foolproof methodology by which we will be able to gather and compile this information. So, and how were we able to do this so far is we learned by building a coalition. And first of all, the Department of Finance learned how to talk with their counterparts at the Department of Health. So previously, there was no dialogue between the economists at the Department of Finance with the doctors and the medical professionals at the Department of Health. But once we started putting together our different but complementary expertise, we were able to achieve so much. And then there's also the coalition with the CSOs. And that has been a strength of the coalition against for tobacco control, because there were so many things that civil society can be able to put out there in terms of information, in terms of the things that they can say, which government cannot, which has helped us to advance the reform. So the important thing is we sustain public support for tobacco control. And to do this, we need to have the evidence, we need to be evidence-based, we need to have the methodology, we need to have strengthened administrative machinery for us to be able to effectively implement the tax reforms. So thank you, Leslie.
Great, thanks so much. Some really good points there as well. And I think I don't know if we have the answer yet to everything that we all have to do to tackle tobacco control, but lots of really good initial kind of first thoughts there. So I maybe just ask if there's any actually questions. If not, I'll maybe just summarize now, but I'm giving everybody the opportunity one last time to ask any specific questions. Okay, I don't see any questions coming up in the chat box, and it looks like we have about 2 or 3 more minutes. So maybe I'll just actually turn to Sarah just one more time here, because we haven't heard from Sarah in a while. And Sarah, you know, you kind of set the scene in the beginning, thinking a lot about all of the different, you know, I guess the scary numbers, I don't want to call them, in the beginning that we've heard, but we've heard a lot today about kind of potential solutions and stuff like that, more kind of at the national and the regional level. So going back to the international level, which you talked about in the beginning, is there, you know, anything that you think in about 2 minutes or so, we could look at about how to kind of couple some solutions maybe coming from the international level with some of the great solutions that we've heard happening at the national and regional level?
Yeah, thanks, Leslie. I think there are a lot of the solutions and ideas that have come up in conversation today that can be connected at the international level, especially in terms of opportunities for collaboration. You know, we heard about collaborating across government departments and agencies, collaborating with civil society and academia as well. And that certainly applies not only the national level, regional level, but internationally as well. There are certainly international actors that are important to connect with and learn from. Of course, the Convention Secretariat plays a key role and provides opportunities to receive technical assistance, to be able to implement some of these solutions and move them forward, as well as opportunities to learn from other parties to the convention, both at the COP and really every day of the year, as we focus on implementation. It's an everyday thing. As well as the international civil society organizations that have a lot of connections with other governments. So it might create opportunities to learn. So not just what are the things we need to learn across regions, but who can we connect with and how can we learn these lessons? And it's the international civil society can play a really great role, as can the Secretariat, in connecting governments so that they can speak directly and learn from each other in that way. And I think by increasing these numbers of conversations and learning these lessons, that's how we can start taking these solutions from the discussion phase to the action phase and learning what actually worked in practice from other people. Thank you.
Great, thanks, Sarah. And I think another placeholder point there to say is we've been from FCA working with a few folks about looking at kind of any other kind of global funding mechanisms that could exist or that could help to kind of support implementation at the national and regional level. And we will be launching a report towards the end of November on looking at other kind of sustainable financing mechanisms. So it's kind of I wouldn't say a continuation to this, but looking at kind of from the international level, what other solutions are out there to support implementation. So, we will be happy to have all of you there to continue this discussion at the international level. I don't want to let out all the secrets yet about what we'll talk about, but do stay tuned for that if you're really interested in this kind of investment and financing discussion. So I see that we just have 2 minutes left, and I really want to stay on time, as I know that everyone has had a very long day listening to all of the incredible panels and plenary sessions going on day 2 of the African Conference for Tobacco and Development. So I might just take a minute to just kind of sum up what I've heard today in a minute, which might be a little bit challenging. But I think we've heard from a lot of the panelists and the speakers today about the importance of obviously taxation, seeing it as a triple win, especially now with COVID and the decrease in revenue in government. So looking at kind of that triple win now for taxation and the kind of return of investment is huge. I think it's, getting that message across within the public and within governments that investment in tobacco control is really a best buy. And so looking at from how we can kind of create those messages and building a new narrative around that to ensure that we raise that awareness. And I think it came up a lot too about the political will. So there's a lot to do, I think, within the government to create those coalitions and get those discussions going. And there's also a lot for civil society and other actors to do in terms of kind of really creating those coalitions and building those relationships on the ground. And then the last part too is the kind of just the local evidence, right? So I think for us, and what Bettina said about really trying to have kind of a national costed plan that has the evidence there. So I think there's a lot of steps. I don't want to kind of create them all today, but starting at looking at your argument, looking at your numbers and the evidence that you have, really trying to build that narrative and create that story. And then looking at how to kind of collaborate across all of those actors to make it happen. And remembering that, when we actually get to the taxation point, the work is not finished there. So there's still a lot of work to do to ensure that that money and increased revenue coming in isn't only, it's going back to healthcare programs and those potential costed national plans that show how much money is really needed for a strong tobacco control program. But what I've learned kind of myself from today is we've heard so much from different regions, and how things vary across regions is really different and very interesting. And I would be very keen on kind of continuing these kind of cross-regional discussions, because I think that We tend to kind of focus on, you know, myself more at the global level, folks probably in Africa working more with collaborators at the regional level, but there's just so much to learn from across the different regions, and kind of continuing these cross-regional dialogues, I think would be really interesting for everybody, looking at kind of best practices and key takeaways that we can take from other countries across the world. So I want to thank everybody for coming today. I know we're out of time, and I would love to continue this discussion a lot more. But I know, as I said, everyone's had a really long day, so I'll probably just stop there. And wanted to thank CTCA and the other organizers of the conference for allowing us this platform during your 3-day conference to have this discussion. And I also wanted to just give a quick shout out to Mrs. Teresa Habitan from the Philippines, who informed me that this will be her last formal speaking engagement before she retires at the end of the month. So I'm very honored to have had you with us, Ms. Habitan, to talk about the Philippines experience once again. And congratulations and best wishes for your retirement. And thanks for joining us. And thank you to all of the other colleagues on the call for joining us.
Thank you, and thank you, Leslie. My honor.
All right.
Thank you.
Thank you, everyone. Have a wonderful Wednesday, I believe we are. Take care.
Thank you.
Thank you.
Bye.